If you have kids returning to school, this is a good time to be aware of some dental challenges and to reinforce some healthy habits. I'm Rochelle Grossman with your latest health news. Experts say parents are instrumental in maintaining healthy oral health, and that means being wise about lunch habits, flossing, and protecting your kids' teeth. It's recommended that parents send their kids to school with flavored water and 2% milk instead of chocolate milk or fruit juices, which can be high in calories and sugar. If your child plays high-impact sports, consider purchasing a mouth guard to protect their teeth. Past studies have shown that children who have dental problems don't perform well. You should speak with a dentist immediately if your child has dental pain.
More women are choosing an aggressive treatment option for a diagnosis of breast cancer, and this trend is rising fastest in a certain group of women. I'm Shelby Cullinan with your latest health news. To track trends in treatment of early-stage breast cancer, a research team reviewed a large database of information to find which type of surgery women chose as their treatment. The results show that when cancer was found in one breast, more young women than in previous years were choosing to have both breasts removed. The authors of the study wrote that the chance of getting cancer in the other breast was only 3% in 5 years and 6% in 10 years. They also explained that these rates have been dropping due to the development of more effective treatments. Ask your oncologist about breast cancer treatment options.
We may be reluctant to think about the waning days of summer, but it's important to prepare for the flu season as it's just around the corner. I'm Miranda Savioli with your latest health news. In a recent report, the U.S. Centers for Disease Control and Prevention provided recommendations for the flu vaccine, such as getting a flu shot for anyone over 6 months old. Children who are receiving the vaccine for the first time may need 2 doses 1 month apart. The live nasal vaccine is suggested for children as well. However, the report lists several factors and conditions that may rule out the nasal vaccine, such as diabetes, asthma, or taking care of someone with a compromised immune system. Wash your hands regularly and avoid sharing food to reduce your risk of catching the flu.
Amyotrophic lateral sclerosis, otherwise known as ALS and sometimes called Lou Gehrig's disease, is a nervous system disease that attacks nerve cells in the brain and spinal cord. These nerve cells transmit messages from the brain and spinal cord to the controllable muscles. No one knows what causes ALS, but it can run in families. At first, this causes mild muscle problems. The earliest symptoms may include twitching, cramping, or stiffness of muscles, muscle weakness affecting an arm or a leg, slurred speech, or difficulty chewing or swallowing. Eventually, strength is lost and it becomes difficult to move. When muscles in the chest fail, breathing becomes impossible. The disease usually strikes between age 40 and 60 years of age. More men than women get it. There is no cure, but medications to control excessive salivation and frequent coughing can help manage the symptoms. Patients with ALS should do breathing exercises and make sure immunizations are up to date. Physical therapy, occupational therapy, and rehabilitation may help to prevent joint immobility and slow muscle weakness and atrophy. Individuals with ALS may eventually consider forms of mechanical ventilation such as respirators.
You expect food to nourish you, not to make you ill, but foodborne illness remains a problem in the U.S., as a new study has shown. I'm Shelby Cullinan with your latest health news. This new study from the CDC looked at preliminary data for 2013 to examine trends in these illnesses during the last year. Salmonella infections, the most common type of foodborne illness, is often transmitted through foods with an animal origin, like meat, milk, or eggs, but any food can become contaminated with bacteria, whereas Vibrio bacteria are usually transmitted through raw or uncooked seafood. The study found that rates of foodborne illness in the U.S. largely stayed stable in 2013. But while salmonella infections decreased, illnesses caused by the bacteria Vibrio saw a big jump. Make sure your food is cooked and cleaned thoroughly before eating.
Prescription medications are familiar to many people in the United States, but just how common are they and which types of medication are we mainly using? I'm Sonia Singh with your latest health news. A new report by the Centers of Disease Control and Prevention, or CDC, analyzed the use of prescription meds in the U.S. The report showed that during 2007 to 2010, almost half of Americans had used a prescription medication in the past month, and many of these Americans were using said medications for heart-related issues and cholesterol levels. Speak with your doctor to learn more about the appropriate use of prescription medications.
Here is some good news for Americans waiting for a kidney transplant. Older adults who donated kidneys were not at an increased risk for heart problems, kidney disease, or dying. I'm Miranda Savioli with your latest health news. A newly published study from the University of Pennsylvania found older kidney donors did not have a different survival rate when compared to non-donors. There was no difference in rates of heart and vessel disease between the two groups, nor was there an increased risk for diabetes, low thyroid function, or osteoarthritis for older donors. However, older kidney donors did have a 53% greater chance of being diagnosed for non-melanoma skin cancer. But the study's authors feel this may be because donors might visit their doctors more often. Speak with your doctor if you are considering a kidney donation.
Vaccines are designed to protect against disease, but babies cannot get most vaccines until they're 2 months old, leaving them vulnerable. A vaccine during pregnancy may help. I'm Shelby Cullinan with your latest health news. A recent study found that giving mothers a vaccine against whooping cough during pregnancy increased their baby's protection against the disease after birth. The vaccine is called Tdap, which stands for tetanus, diphtheria, and acellular pertussis. The newborns whose mothers received the Tdap during pregnancy had more antibodies against whooping cough than the babies of mothers who received the Tdap after giving birth. Ask your OBGYN about the Tdap vaccine during pregnancy.
Summertime brings sunshine and warmth, but also mosquitoes and attempts to ward them off. Many people might wonder whether insect repellents with DEET are safe. I'm Erin White with your latest health news. DEET stands for N,N-diethylmetatoluamide, a compound shown to be effective in warding off insects. A recent study found no evidence of negative health side effects related to the use of DEET at the recommended levels. Take steps this season to prevent mosquito bites.
Poor diet can contribute to the risk of developing type 2 diabetes, but which is the right diet to reduce that risk? I'm Shelby Cullinan with your latest health news. People with type 2 diabetes have high blood sugar because their bodies do not use insulin effectively to reduce the blood sugar levels. Results of a recent study have shown that several healthy diets, including the DASH and Mediterranean diets, can reduce the risk of developing type 2 diabetes. These diets emphasize vegetables, fruits, whole grains, beans, seeds, nuts, and healthy fats, as well as certain types of lean meats, fish, and low-fat dairy products. Ask your doctor how to cut your diabetes risk.
Over-the-counter painkillers might appear to all have the same purpose, reducing pain, but they aren't all created equal. Many of these medicines have different effects, side effects, and purposes. Are you taking the one right for you? I'm Erin White, and this is a health feature. Over-the-counter pain relievers generally fall into two groups: acetaminophen, which includes the brand name Tylenol, and non-steroidal anti-inflammatory drugs, or NSAIDs, which include ibuprofen and aspirin. Acetaminophen is a medication frequently used to relieve pain and fever, and is the most common medication ingredient in the U.S. It is sold alone or as an active ingredient in many other products. It's found in some cold medications, such as Sudafed, and in some sleep aids, such as Unisom PM pain sleep caps. Since acetaminophen is commonly used in other medications sold over the counter, it's important to know whether other medications contain it, as there is a limit to how much acetaminophen can be safely consumed in a day. Acetaminophen does not treat inflammation, which is characterized by red or swollen tissue, but can be a good choice for migraine-type headaches that are often felt across the forehead. NSAIDs relieve the pain of arthritis, menstrual cramps, headaches, and general aches and pains. They can cause relatively minor side effects like abdominal pain and diarrhea. Extended use can cause more serious side effects like stomach ulcers. Certain NSAIDs take particularly long to clear the body. This may be true in someone who is elderly or someone who has kidney problems. For this reason, anyone taking NSAIDs regularly should consult their doctor. And despite its status as an NSAID, aspirin is rarely used in the same way ibuprofen or naproxen are. In fact, it is rarely recommended as a painkiller, though it can relieve headaches and other minor aches and pains because it can cause dangerous side effects. Ask a doctor what the best over-the-counter pain reliever would be to cure your symptoms.
For many, using aspirin can be a huge help when it comes to fending off a headache and reducing the risk of a heart attack. However, could aspirin also help lower the risk of a certain type of cancer? I'm Sonia Singh with your latest health news. A new study funded in part by the National Cancer Institute has found that people who carry a particular gene may reduce their risk of colorectal cancer by taking aspirin. The study focused on over 200 colon cancer cases that developed over the course of 3 decades. Although research is ongoing, researchers concluded that doctors could safely take a biopsy from the colon during a colonoscopy to determine which individuals would benefit from a daily low-dose aspirin regimen. Speak with your doctor to learn more about the benefits of aspirin.
Anemia happens when the blood does not carry enough oxygen to the rest of the body. Anemia is caused by not having enough iron. Anemia has 3 main causes, which are blood loss, lack of red blood cell production, and high rates of red blood cell destruction. Anemia can make one feel tired, cold, dizzy, irritable, and shortness of breath. In addition, anemia can cause headaches. Conditions that may lead to anemia include heavy periods, a diet that does not have enough iron, folic acid, or vitamin B12, pregnancy, and ulcers. In addition, certain conditions such as the following can increase the risk for anemia: colon polyps or colon cancer, inherited disorders, certain blood disorders, aplastic anemia, and G6PD deficiency. Treatment depends on the kind of anemia. Treatment may include vitamins such as vitamin B12 and folic acid or iron supplements. Erythropoietin may also be prescribed to increase the number of red blood cells in the body. Eating a healthy diet can help prevent and/or help manage anemia. Changes to the diet may be made to raise the vitamin and/or iron level.
Untreated appendicitis can have serious consequences, but surgery may not be the only option for children with the condition. I'm Erin White with your latest health news. Appendicitis occurs when the appendix becomes inflamed or infected, swollen, and painful. Researchers found that appendicitis was successfully treated with antibiotics in almost all of the children who were treated with them. This treatment meant kids could return to school sooner and felt better than the children whose appendicitis was treated with surgery. Speak with a doctor about the risks and benefits of different treatment options.
Many people drink caffeinated drinks like coffee or tea on a daily basis. It's possible that even small changes in coffee consumption could affect their health in a major way. I'm Shelby Cullinan with your latest health news. A recent study found that people who increased their coffee consumption by more than 1 cup per day over a 4-year period were 11% less likely to develop type 2 diabetes in the following 4-year period compared to people who did not change their average coffee consumption. The findings reveal that these increases and decreases in type 2 diabetes risk were only associated with caffeinated coffee. Discuss your daily coffee consumption with a doctor.
To get the best and trusted health and medication information, join us at rxwiki.com. Sign up for the rxwiki.com newsletter by going to rxwiki.com and clicking subscribe on the right side of the RxWiki homepage to receive the latest health news and videos delivered in a consistent and easy-to-understand language. rxwiki.com, for patients by pharmacists.
For those with chronic high blood pressure, keeping healthy is essential. Exercising and maintaining a healthy diet can delay or prevent diabetes. These interventions can even save lives. I'm Sonia Singh with your latest health news. Prediabetes is constantly high blood sugar that isn't quite high enough to qualify as diabetes. A study was conducted with patients who have this condition, some of which were assigned to a diet or exercise intervention, while others received standard medical treatment. Following up 20 years later, the intervention group had significantly lower rates of death from all causes and from heart disease, as well as lower rates of diabetes. Speak to your doctor about diabetes prevention and treatment.
Cerebral palsy is a group of disorders that affect a person's ability to move and to maintain balance and posture. Cerebral palsy is caused by an abnormal brain development or damage to the developing brain that affects a person's ability to control his or her muscles. Cerebral palsy can be caused by genetic abnormalities. Other possible causes include congenital brain malformations, maternal infections or fevers, or fetal injury. The symptoms of cerebral palsy vary from person to person. Those with cerebral palsy may exhibit a wide variety of symptoms, including lack of muscle coordination, stiff or tight muscles, and exaggerated reflexes, or spasticity. Weakness in one or more arm or leg is also another symptom. People with cerebral palsy may have difficulty walking and may have trouble with tasks such as writing or using scissors. Some have other medical conditions, including seizure disorders or mental impairment. The signs of cerebral palsy usually appear in the early months of life, although specific diagnosis may be delayed until age 2 years or later. Risk factors include low birth weight and premature birth, infections during pregnancy, and complicated labor or delivery. There is no cure for cerebral palsy, but treatment can improve the lives of those who have it. Medications such as botulinum toxin can be given to help manage spastic movement disorders. Physical, occupational, speech therapy, and recreation therapy can all help patients with cerebral palsy.
Although children have been eating more fruit in recent years, they still may not be eating enough fruits and vegetables overall. I'm Erin White with your latest health news. The CDC recently released guidelines for fruit and vegetable consumption per age group and tracked average intake. Based on the newest data, most children needed to increase both fruit and vegetable consumption to meet the guidelines. The researchers wrote that eating more fruits and vegetables adds needed nutrients, reduces risk of death and illness, and helps manage body weight. Incorporate fruits and veggies into a healthy diet. At one point or another, almost everyone gets constipated. Fortunately, most cases can be resolved with simple changes to diet and exercise. Sometimes, though, constipation can lead to complications. I'm Erin White, and this is a health feature. Constipation is a condition in which a person has fewer bowel movements than usual. In any given person, there may be several causes for constipation, including a lack of fiber, not drinking enough fluid, an inactive lifestyle, and changes to one's environment. However, constipation may also be associated with a more serious condition, such as diabetes, scleroderma, thyroid disease, multiple sclerosis, or Parkinson's disease. In most cases, constipation is acute and not likely to cause serious problems, but it can still cause complications. These may include hemorrhoids, anal fissures, rectal prolapse, and fecal impaction. Treatment options vary depending on the cause, severity, and duration of the constipation. Fiber-rich food is necessary to normalize and maintain bowel function. Reducing the amount of refined and processed foods, such as processed meats, cheese, and ice cream that you consume each day may also ease constipation. Instead, choose foods with natural fiber, like vegetables, fruits, beans, cereals, and breads. Exercise daily and ask your pharmacist if your medications can cause constipation. If so, talk to your primary care doctor to see if a change to your medication, or stopping altogether, is right for you. In severe cases, surgery might be needed. Biofeedback, a method that can be used to retrain the anorectal muscles, may be another possibility. Eat plenty of fiber, exercise daily, and speak with your doctor about any constipation issues you may have.
A woman experiences a variety of changes to her body while she's pregnant. While these are normal changes, they might influence her alertness or the way she's feeling occasionally. I'm Shelby Cullinan with your latest health news. If any person is feeling tired, nauseated, or otherwise not well, it may increase their risk of an accident while driving. A recent study found that pregnant women who may feel fatigue or nausea more often than usual had a higher risk of a car accident while driving in their second trimester compared to their risk while not pregnant. Be alert and follow traffic laws while driving.
Taking prenatal vitamins is important for pregnant and breastfeeding women, but even these supplements may not give women enough of one crucial substance. I'm Kendra Rowland with your latest health news. A recent statement reviewed the importance of adequate iodine intake for pregnant and breastfeeding mothers. Many women do not get enough iodine, which can be found in yogurt, milk, iodized salt, shrimp, lobster, and other foods. Doctors recommend that pregnant and breastfeeding women take daily supplements of at least 150 micrograms of iodide. Ask your OB/GYN about taking iodine supplements.
Here's another reason to make whole grains and vegetables a part of your diet. Getting enough dietary fiber may be a life-changing health decision for people who've had a heart attack. I'm Erin White with your latest health news. Fiber is commonly found in vegetables, fruits, beans, legumes, and whole grains. Recent research looked at the link between dietary fiber consumption and death in people who had previously had a heart attack. The researchers found that participants who ate the most fiber had better survival odds than those who ate the least. They noted that dietary fiber from cereals provided the strongest protection against death. Get your daily recommended amount of dietary fiber. One of the scariest moments for a parent can be seeing their child hit in the head, especially if that hit is hard. If they sustain a concussion, it's important to know some guidelines for recovery. I'm Mindy Cook with your latest health news. Guidelines were recently published to help doctors in diagnosing and treating concussion injuries in children, but the information is valuable to parents as well. Red flags to note following a concussion involve neck pain, confusion, irritability, repeated vomiting, severe or increasing headaches, and unusual behavior changes. The published guidance suggests taking your child to the hospital if you notice these symptoms. A doctor should give advice on how to manage sleep, fatigue, and social interactions. Rest your mind and body while recovering from a concussion. Consuming lots of sugary drinks can expand your waistline, but you may not be aware of what it also might do to your blood pressure. I'm Erin White with your latest health news. Sugar is added to many food products, but the largest source of added sugar we consume is in sugar-sweetened drinks. Drinking sugar-sweetened beverages has been linked to obesity, high blood sugar, heart disease, and kidney stones. Recently published research found it was also associated with increased blood pressure and a greater risk for developing hypertension. The studies that researchers analyzed showed a 26 to 70% increased risk of developing high blood pressure in people who consumed sugar-sweetened beverages compared to people who did not drink sugar-sweetened beverages. Speak with a doctor about healthy blood pressure levels and limit your consumption of sugar-sweetened beverages.
Hypertension, or otherwise known as high blood pressure, is a condition identified by blood pressure that rises and stays higher than what is normal. High blood pressure often has no immediate noticeable signs or symptoms, but very high blood pressure can cause headaches, vision problems, and even damage certain organs. Hypertension that lasts for a long time can cause kidney damage, heart damage, and increase the risk of a stroke. Obese patients, older patients, smokers, diabetics, and patients with poor diets or a family history of high blood pressure are at a high risk of having high blood pressure. Alcohol abuse and illegal drug use can also cause blood pressure to rise. High blood pressure can be treated through healthy lifestyle changes such as diet and exercise, but in many cases, medications can help safely and effectively adjust blood pressure back to normal levels. ACE inhibitors such as lisinopril and diuretics such as hydrochlorothiazide are commonly used to treat high blood pressure. A wide variety of blood pressure medications are useful in different situations to treat hypertension when other medications fail. Preventing and managing hypertension is important to living a healthy life. Maintain an active lifestyle with plenty of exercise and avoid excessive salt intake in your diet. If you have a family history of hypertension or other major risk factors, take the time to monitor your blood pressure periodically.
Drinking alcohol or smoking has been shown to increase the risk for esophageal cancer, and enjoying the two vices together might raise that cancer risk even further. I'm Shelby Cullinan with your latest health news. Esophageal cancer is cancer of the tube that carries food and drink to the stomach. While the combined effect of drinking alcohol and smoking increased the chance of developing esophageal cancer, researchers reported that when the two habits were taken together, the cancer risk was greater than having either habit on its own. The researchers recommended that the intake of alcohol and the use of tobacco be reduced as much as possible. Tell your doctor if you drink alcohol or smoke.
COPD causes difficult breathing, which can lead to anxiety and insomnia. A new study says a common type of medication used to ease these symptoms may not be the best option for those with COPD. I'm Erin White with your latest health news. This new study showed a significant increase in the risk of COPD patients having a severe respiratory event, such as shortness of breath or fits of coughing, when prescribed a benzodiazepine medication. Study data showed that COPD patients who used benzodiazepines were 45% more likely to experience respiratory-related side effects than the group not taking benzodiazepines, as well as 92% more likely than the benzodiazepine-free group to require emergency room treatment caused by increased severity of their COPD symptoms or the development of pneumonia. Speak with a doctor about your COPD symptoms and medication that is safe and effective for your condition.
Asthma is a chronic airway disease that can negatively affect a patient's breathing. During an asthma attack, the inside walls of the airways become inflamed and swollen. This causes the airways to become narrower and decreases the amount of air that can come in and out of the lungs. Symptoms of asthma include wheezing, coughing, especially early in the morning or at night, chest tightness, and shortness of breath. Not all people who have asthma have all of these symptoms. These symptoms alone don't always indicate a case of asthma. Allergens such as pollen and animal dander, and air pollutants and irritants such as cigarette smoke can trigger asthma. Cold weather and exercise are also common triggers. Severe asthma attacks may require emergency care. Asthma is commonly treated with two kinds of medications: quick relief rescue medications such as albuterol to stop asthma symptoms, and long-term treatments like inhaled corticosteroids and leukotriene antagonists to provide sustained relief. Asthma patients should be very aware of their asthma triggers and keep a rescue inhaler nearby at all times. Asthma in children can be especially dangerous, so parents should learn the signs of an asthma attack and what to do. Make sure if you have asthma to take your medications regularly and to have a plan whenever you may have an asthma attack.
The risks of smoking can extend beyond your own health and that of the individuals breathing the secondhand smoke. They may extend to your children's choices as well. I'm Shelby Cullinan with your latest health news. A recent study found that teens were increasingly more likely to smoke with each extra year their parents smoked since the kids were born. Even if the teens were not regular smokers, they were more likely to experiment early on with smoking for each additional year their parents lit up. Quit smoking before having kids.
If you have allergies, you know your symptoms can change during the day. And based on new research, there might be a pattern to when your pollen allergies are at their worst. I'm Rochelle Grossman with your latest health news. A team in Denmark found there may be specific times when allergy sufferers should stay indoors, and those times change. The research found the early season displayed two peaks, in the morning and evening. The mid-season pollen count spiked once in the evening, and the late season peak came in the late morning into early afternoon. Keep up with your local pollen count forecast to work with the change in peak hours and talk to your doctor about managing seasonal allergies.
E-cigarettes have become a popular fad among smokers and have often been used as a substitute for regular cigarettes. Yet the debate surrounding them has grown, and now rules governing the products may become stricter. I'm Kendra Rowland with your latest health news. The FDA has proposed that e-cigarettes and other tobacco products would fall under their regulation. The FDA currently regulates certain tobacco products, including cigarettes, roll-your-own tobacco, and smokeless tobacco, but not others. The proposed change would extend this regulatory authority to include additional products. The rules would require e-cigarettes to include health warnings and only make health claims confirmed by the FDA. Speak with your doctor about healthy ways to quit smoking.
Celiac disease is not common among children, but it may have been underdiagnosed until recent years. Knowing risk factors for it may help parents. I'm Shelby Cullinan with your latest health news. A recent study was conducted of nearly 1,000 children in Italy who were assessed for stomach problems. The children were classified as having either irritable bowel syndrome, abdominal pain, or upset stomach indigestion. The study found that children with irritable bowel syndrome are 4 times more likely to have celiac disease than children without irritable bowel syndrome. These findings mean that parents of children with irritable bowel syndrome may want to ask about screening for celiac disease. Ask your pediatrician about celiac disease screening.